Next topic is the electrolyte disturbances. Okay, you can clearly see that. Okay, so guys, the most common one is the sodium. So for sodium, remember, sodium affect your CNS. Okay, when either sodium is low, either high, you will have CNS issues. Like in low serum concentration, you will have nausea, malaise, stupor, coma, and seizure. And high, you will have irritability, stupor, and coma. Okay, so mnemonic sodium affect your okay, yeah, okay. Sodium can cause somnolence, though both as mnemonic. I remember one word: sodium affect your CNS. That's it. And potassium affect your, you can say, it can affect your heart. Okay, it can affect your muscle. So in one word you can say potassium will affect your muscle, both cardiac muscle and other muscle. That's it. Sodium affect CNS, potassium affect your muscles. That's it. So when you will have low serum potassium concentration, okay, on ECG that is important. You will have U wave and flat T wave. When you have high potassium, you will have peak T wave. So how I have make mnemonic? Okay, when you will have low serum concentration, the T wave, okay, so normal T wave is like that. So that is T wave. When you have low serum concentration, okay, that T will be lower. That is mnemonic. Okay, okay, so either T wave will lower or you will have U wave. After the T wave, you will have dip. That is called U. So I pronounce hypokalemia like that. Hypo. So I just replace O with U. Hypokalemia. That is in the morning. So on ECG in high serum concentration, what will happen? That T will be, you can see, peaked. So T wave will decrease when potassium is decreased. That's it. And T wave will increase when the potassium is increased. So in this simple way, guys, there is also a multiple other ECG finding. Like you can have sinusoidal wave, you can have prolonged PR interval, okay, you will have wide chorus complex like that. There are multiple other ECG finding of both hypokalemia. Also, there are multiple finding for hyperkalemia. But remember, these two are important. Okay, in you can say in hypokalemia, you will have U wave and flat T wave mean it is lower. Just it's lower. That's it. And mnemonic. And when you have high serum concentration, okay, T wave is increased. Mean just as a mnemonic. Okay, not increase. It will be just speed up. When potassium is raising, so is the T wave is increasing. That's it. We are done. Then is the calcium. So, guys, for calcium, magnesium, okay, it mainly affect your, you can say same. It will affect the uh, heart and muscle. Most important here is the in potassium, focus will be on ECG. Focus will be on the heart. Or in calcium, magnesium, focus will be on the skeletal muscle. So in calcium, you can say you will have tetany. Okay, you will have spasm, tetanic spasm. Okay, you in this case ECG finding is the QT prolongation. Okay, the spasm, the sign are given, Trousel sign, chopstick sign, we will discuss in Nando. Okay, mnemonic is given, stone, zones, groans, thrones, skeptic overtone. All we will discuss in the future lecture. Then magnesium. Magnesium effect is same as the, you can say, in the like the calcium. When there is low serum concentration, you will have tetany. Important point. This is very high yield. Remember, tertiary point. Okay, we will discuss. You will have polymorphic. You can see like that ECG finding. Okay, tertiary point. We'll cover in cardiology. And high, you can have. This is very high yield point. Guys, remember, if patient is coming with hypokalemia, potassium is lower. This is high yield point. I'm talking about this point. If patient is having hypokalemia, you give the patient potassium. Still, patient is having recurrent hypokalemia. Okay, always check magnesium level. And magnesium is lowered. Okay, you can't correct potassium. Okay, I'm repeating again. If magnesium is lowered, you are having hypomagnesemia. Okay, that actually magnesium normally inhibit a channel that is called ROMK. Okay, that is the renal medullary potassium channel. Normally, magnesium will block that channel. Okay, will block, inhibit that channel. This is a potassium excretory channel. Okay, if magnesium is lowered, what will happen? This inhibition will be over. Now, what will happen? This channel will excrete potassium outside. No matter how much you give the potassium to patient, okay, patient still will have hypokalemia. This is high yield point. Okay, okay, that is hypomagnesemia when the magnesium level is high, and when the okay. So here is a scenario. Okay, whenever history is given up like preeclampsia, okay, eclampsia, or torsade D point, you will always give magnesium sulfate. That is a drug of choice. Okay, I'm just giving a question. You word question like that. A patient is come with like patient come with hypertension, proteinuria, and then patient develops seizure. You as a physician give a drug, and then patient develop. Okay, patient develop lethargy. Patient develop, you can say, uh, decreased reflexes. Okay, so what will be the cause? It is called magnesium toxicity. Okay, you have overdosed the patient with magnesium sulfate. Okay, whenever question will come, scenario will be same. History given, you give a drug, then patient develop. Okay, patient develop decreased deep tendon reflexes. Patient develop lethargy. The patient develop decreased reflexes. Even it will affect all muscles. Like you will, in mild cases, it will affect muscle. In mild muscle, so that's a demonic. Mild muscle. So magnesium M stands for muscle. Okay. So in mild cases, you will have muscle effect. In severe cases, it will mute your heart. You will have cardiac arrest. Okay. You will have hypotension. You can have bradycardia like that. So remember. Then last one is the phosphate. Okay. Again, when you will have decreased phosphate, okay, you will have bone loss because to make a bone, you should need two things like calcium and phosphate. So either calcium deficiency or phosphate deficiency, okay, you can develop rickets and you can say osteomalacia. Okay, that's it. And if the phosphate is high, what will happen? Suppose this is a vessel and you are having more phosphate. Okay, you will also have calcium there in the blood. When phosphate is more, it will combine with this calcium. Okay, it will make a, you can see guys, it will make calcium phosphate crystal. And this calcium phosphate crystal, okay, will deposit in the vessels, in damaged walls, and all over your body. That is called metastatic calcification. Okay, when calcium is used up, what will happen? You will have decreased calcium level. Okay, because phosphate is binding calcium, and this complex is depositing on your different body parts in liver, in kidney, or in damaged wall, in all over your blood vessel. What will happen now? High phosphate will decrease the calcium. And also, this calcium phosphate, okay, when you have high phosphate will go into urine. Okay, there it will combine with calcium. They will form calcium phosphate stone. That's it. Okay, so that is the topic. Next topic, our